A helping hand withdrawn, the U.S. foreign aid freeze. The United States has long been a beacon of hope for many around the world, extending a helping hand through its foreign aid programs. These programs, designed to alleviate poverty, combat disease, and provide humanitarian assistance, have been a lifeline for millions. However, recent events have cast a long shadow on this legacy. The U.S. State Department has frozen nearly all foreign assistance, enacting a stop work order that has sent shockwaves across the globe. This 90-day pause, intended to review and align aid with current presidential priorities, has had immediate and far-reaching consequences. This freeze is not just a budgetary maneuver, it's a decision that directly impacts real lives. The sudden halt of funds has thrown countless ongoing projects into disarray, leaving vulnerable populations in a precarious state. From halted vaccination campaigns to disrupted food supplies, the consequences of this freeze are being felt by the most vulnerable among us. The impact of the aid freeze extends beyond immediate humanitarian concerns. It has also raised serious questions about the U.S.'s commitment to global stability and its role as a global leader. By pulling back from its international commitments, the U.S. risks jeopardizing its relationships with key allies and undermining its own strategic interests. The decision to freeze foreign aid has been met with widespread criticism, both domestically and internationally. Critics argue that the move is short-sighted and will ultimately do more harm than good. They emphasize the importance of foreign aid in advancing U.S. interests, promoting global stability, and upholding humanitarian values. The freeze has not only disrupted immediate aid, but also threatens long-term development projects that are crucial for sustainable growth in many regions. As the world watches closely, the U.S. must consider the broader implications of its actions on the global stage. Millions of children in the balance. The human cost of this freeze is staggering, with the most vulnerable bearing the brunt of the impact. These children, who are already living in precarious conditions, are now facing even greater challenges. A staggering 6.5 million orphans and vulnerable children across 23 countries are now facing a dire situation. This number is not just a statistic, it represents real lives at risk. These children, already grappling with poverty, lack of access to education and healthcare, are now at an even greater risk. The freeze has exacerbated their already difficult circumstances. The aid freeze has meant a sudden stop to the essential services they relied upon, leaving them more susceptible to disease, hunger, and exploitation. The safety nets that once provided some semblance of security have vanished. These 6.5 million children are not just a statistic, they are individuals with hopes, dreams, and the right to a future. Each child has a unique story and potential that deserves to be nurtured. The aid freeze robs them of the opportunity to reach their full potential and condemns them to a life of struggle and hardship. It is a theft of their future. It's a moral crisis that demands immediate attention. The world cannot turn a blind eye to the suffering of these innocent lives. The suspension of programs aimed at providing food, shelter, and education has created a ripple effect, pushing these children further into the margins. The consequences are far-reaching and devastating. The psychological toll on these young minds, already grappling with uncertainty and instability, is immeasurable. The trauma they experience now will have long-lasting effects. The aid freeze is not just an economic issue, it's a humanitarian crisis that demands urgent action. The time to act is now. The international community has a moral obligation to ensure that these children are not forgotten. Collective action is needed to address this crisis. The U.S., as a global leader, must acknowledge the devastating impact of its actions and take immediate steps to rectify the situation. Leadership comes with responsibility. The futures of millions of children hang in the balance, and the world is watching. We must act now to change their fate. The crumbling frontline global health programs at risk. The consequences of halting funding for global health programs are dire and far-reaching. These programs are often the lifeline for many communities, providing essential medical services and support. The world is battling a multitude of health challenges, from emerging infectious diseases to chronic illnesses, and the U.S. has played a critical role in these efforts. The support from the U.S. has been instrumental in combating these health crises. However, the recent aid freeze has brought many of these programs to a grinding halt, jeopardizing the progress made and putting global health security at risk. The ripple effects of this decision are being felt worldwide. One of the most pressing concerns is the suspension of efforts to contain the Marburg virus outbreak in Tanzania. This virus, similar to Ebola, requires immediate and sustained intervention. This highly infectious and deadly disease poses a significant threat to global health, and the US's withdrawal of support has left a critical gap in containment efforts. Without adequate resources, the situation could spiral out of control. The consequences of an uncontrolled outbreak could be devastating, not just for Tanzania but for the entire world. The interconnected nature of our global community means that no country is truly isolated from such threats. The fight against a deadly mpox variant affecting children in West Africa has also been severely hampered. This variant is particularly dangerous for young children, who are the most vulnerable. This variant, known for its severity in young children, requires a coordinated global response to prevent its spread and mitigate its impact. The lack of support has made it difficult to mount an effective response. The US's decision to freeze aid has weakened this response, putting countless children at risk. The health and future of these children hang in the balance. Furthermore, the halt in monitoring bird flu in 49 countries is a cause for serious concern. Bird flu surveillance is crucial in preventing potential pandemics. Bird flu, with its potential to mutate and jump to humans, poses a constant threat to global health. Vigilant monitoring and rapid response are essential to prevent outbreaks. The US's withdrawal of support for surveillance and monitoring efforts increases the risk of an undetected outbreak, potentially leading to a global pandemic. The world cannot afford to let its guard down. Operational chaos and uncertain futures. The suspension of foreign aid has thrown numerous operational plans into chaos. Organizations that rely on US funding are scrambling to find alternative sources of support. This uncertainty affects not only current projects but also the planning and implementation of future initiatives. The lack of clarity and stability is undermining efforts to build sustainable solutions to global challenges. The uncertainty surrounding the future of US foreign aid is causing widespread concern. Aid organizations are facing difficult decisions about resource allocation, often having to choose between equally critical needs. This operational chaos is not just an administrative headache, it has real-world implications for the people these organizations serve. The freeze has also led to a loss of trust in the US as a reliable partner in global development. Allies and partner nations are questioning the US's commitment to shared goals and values. This erosion of trust could have long-term consequences for international cooperation and collaboration. The future of US foreign aid remains uncertain, and the world is watching closely. The decisions made in the coming months will have a profound impact on millions of lives and on the US's role in the world. It is crucial that the US reaffirms its commitment to global development and humanitarian assistance. The stakes are high and the world cannot afford to wait. It's important to understand that US foreign aid has been a cornerstone of international relations for decades. But now we're facing a moment where its future is, well, uncertain. The potential freeze on this aid could have far-reaching consequences, not just for the countries that rely on this support, but also for global stability and, America's own strategic interests. We need to consider the broader implications of these decisions. What happens if the aid stops? How do we navigate this new landscape? These are the questions we need to, start asking ourselves. Dr. Atul Gawande, a renowned surgeon and public health researcher, shares his insights on the critical need for sustained foreign aid. He emphasizes that, without continuous support, many healthcare systems in developing countries could collapse, leaving millions without essential medical services. Dr. Gawande's message is clear. The freeze on foreign aid is not just a financial decision, but a moral one, with far-reaching consequences. Short-sighted policies often lead to long-term repercussions. When foreign aid is frozen, it disrupts the progress made in healthcare, education, and infrastructure in vulnerable regions. These setbacks can take years, if not decades, to overcome. The cost is not just measured in dollars, but in human lives and potential lost. It's crucial to consider the broader impact of these decisions and strive for policies that prioritize sustainable growth and development. It's time to rethink the freeze on foreign aid. Policymakers must recognize that global cooperation and assistance are vital for a stable and prosperous world. By reinstating and even increasing foreign aid, we can help build resilient communities, foster economic growth, and promote peace. The benefits of a well-supported global community far outweigh the costs, making it an investment in our collective future. Compassion and global cooperation have always been the cornerstones of a thriving international community. Even in the face of adversity, these values can drive significant positive change. By working together and supporting one another, we can overcome challenges and build a better world for all. The enduring power of compassion reminds us that our shared humanity transcends borders, and it's this spirit that will guide us toward a more just and equitable future.